Good morning, everybody. Thank you so much for joining us for today's Medicare 101 workshop. Um, it is hosted by the New Mexico Aging and Long-Term Services Department. Our secretary is Katrina Hotram Lopez, and I'm Chris Winterode. I'm one of the SHIP coordinators for the state, and I'll tell you more about what that means in just a minute. As I've already mentioned, today's presentation is going to be recorded and we will post it on the Aging and Long-Term Services Department website. I'm going to ask that you keep your camera off and your microphone muted unless you're asking a question. Sometimes, people like to take their questions at the very end. I am a teacher, so I like to take questions as we go along. So I'll pause periodically and ask if you have any questions, and you're welcome to unmute yourself at that time and ask your question. You can also type it into the chat if you prefer. Okay, we are here for Medicare 101 today. Medicare is complex and a lot of people get overwhelmed because it's a very different way to get your health care than most people have ever experienced. And so today's presentation is designed to just give you an overview of the parts of Medicare and the kinds of decisions that you have to make in order to make sure your care is complete, your coverage is complete with Medicare. I'm going to talk to you about SHIP and SMP, two very important consumer assistance programs. We're going to go over all the parts of Medicare, A, B, C, and D. I'm going to talk about Medicare enrollment, what your Medicare options are. I'm going to give you some COVID updates. I keep thinking I'm going to take this out, but I never do. We're surging again, so it just continues to be relevant. And also some other resources that might be useful to you that aren't directly related to Medicare, but I think are pretty important. So our New Mexico SHIP program, SHIP stands for State Health Insurance Assistance Program. We are a federal state partnership. So I'm a state employee. I work for the Aging and Long-Term Services Department. But we are in partnership with the Centers for Medicare and Medicaid. We're contracted by that federal program to provide free, unbiased, expert information and assistance for on Medicare and Medicaid. So we do counseling, education, outreach, and we work with people who are on or will soon start Medicare. We work with family members, caregivers, and we provide a lot of different kinds of support. This Medicare 101 education is just one part of what I do. I also help people resolve issues that they're having with their Medicare coverage. I can follow through with people until those issues are resolved. When people are having problems or looking for resources and they reach out to the governor's office or their congressional representatives, we help with that too. And there's just a wide variety of resources available through the SHIP program. Oops, Mary, can you mute yourself? Okay. Let's go. There we go. The next program that I want to just introduce you to is the Senior Medicare Patrol.
I'll do it another time.
Sounds like Mary's having technical difficulties. Senior Medicare Patrol is the part of our program that's tasked with healthcare fraud education and prevention. They're there to help people avoid, detect, and prevent healthcare fraud. And this is super important to protect you, but also to protect the integrity of Medicare and Medicaid so that those programs are able to continue. Most people, I think, are aware of how to protect themselves, but fraudsters and scammers are endlessly creative And, I talk to people regularly who tell me, I knew I shouldn't have done that, but, I gave them some information when they called me over the phone. Now what? Now what do I do? So it's really important for you to know that if you find yourself in that situation, this program is here to provide that assistance for you. One of the things that comes up, I've dealt with this like 3 times in the last month, where someone who's already on Medicare got a call and was switched without their knowledge or consent into a different Medicare plan. And we can help resolve those issues too. Okay. Before we go on and dig into Medicare, does anybody have any questions about SMP or SHIP? Okay.
No.
All right. Thanks, Eloise. Medicare 101 is Medicare is health insurance for adults 65 or older, and also younger adults with certain disabilities. And we'll talk about when Medicare starts for different groups of people. But it's important to know that you don't have to necessarily be 65 in order to be on Medicare. Sometimes people with disabilities go on sooner, and anyone with end-stage renal disease qualifies for Medicare. So upon turning 65, you qualify for Medicare if you're collecting Social Security, or you qualify to collect Social Security or railroad retirement benefits. You don't have to actually be collecting your Social Security yet. I'm talking to more and more people who are opting to wait until that Social Security payout maximizes at, I think it's 66 and 4 months or 67 years old. People who are current U.S. residents, U.S. citizens, or a permanent resident who's lived in the U.S. for at least 5 years can qualify for Medicare. If you're not yet 65, you qualify for Medicare if you have received Social Security disability for at least 24 months, 2 years. Once people have been on Social Security disability or railroad disability for 2 years, they switch over onto Medicare. With ALS, there's no waiting period, and end-stage renal disease also. Okay. If you are receiving a Social Security check when you turn 65, if you've already opted to start getting your Social Security payments, or you're starting at age 65, then you're automatically going to be enrolled in Medicare Parts A and B. If you're not collecting your Social Security check yet, you have to actively enroll yourself online at www.ssa.gov or at the SSA office. I highly recommend doing it online. It's easy to do, and certainly through the pandemic, it's been very difficult to reach Social Security. In fact, they, gave an extension for people who weren't able to reach them to enroll in Medicare. But you can enroll. It's easy to do online at ssa.gov. And if you need assistance with that, you can reach out to the SHIP program and we'll help you with it. Your initial enrollment period starts 3 months before you turn 65, continues through the month of your birthday, and for 3 months after the month of your birthday. So you have a 7-month initial enrollment period to get your Medicare enrollment and all of your coverage set up. So, like I just mentioned, that initial enrollment period lasts for 7 months. If you miss that for some reason, generally speaking, you're going to need to enroll during the general enrollment period, which is every year from January 1st through March 31st. Right now, coverage begins July 1st. They're talking about changing that rule to eliminate that gap and have your coverage begin the month after you enroll during the general enrollment period. I think that's going to start next year. I really hope so, because for people who have to enroll during the general enrollment period, if they missed their initial enrollment, they've already had a gap in coverage, and to have that gap, last another 6 months once they've enrolled is really something that I hope we can eliminate. There's also certain special enrollment periods. These generally relate to people who already have Medicare and need to change their coverage for some reason. But if you're still working and you're covered under active employer insurance, you don't actually have to enroll in Medicare when you turn 65. You can choose to delay that until you retire or end your active employer coverage. And in that case, you do get a special enrollment period for the end of that active employer insurance, and that is an 8-month-long enrollment period. Okay, here's what your Medicare card looks like in case you haven't seen one. Your Medicare card is always just going to show Part A and Part B. It's never going to show your other coverage. It's not going to show your Part D drug plan or your Medicare Advantage plan. That's not going to be on your card, because your card isn't going to change every year. Certain parts of your coverage, your drug plan, your Medicare Advantage plan, you can change every year during the open enrollment period. And Medicare is not going to issue new Medicare cards every time you change those additional pieces of your coverage. So this is your basic Medicare card. It's going to stay the same. You're not going to get another one unless your card is lost or destroyed, in which case you can request one from Medicare. So it's always just going to show Part A and Part B, or whichever parts of Medicare you qualify. Not everybody qualifies. Not everybody has both Part A and Part B. If you choose to decline Part B, and we're going to talk a lot about what to think about before you do that, you just follow the instructions on the back of the card, you return it, and they'll issue you a new card with your the coverage that you've accepted. Okay, here are the basic building blocks of Medicare, and I think of it like a little Lego kit. Depending on how you put the blocks together, which pieces of coverage you opt for, you're going to have a very different health insurance experience. So the first type of coverage is what we call original Medicare. With original Medicare, you have your Part A hospital coverage, your Part B outpatient coverage. You're going to add a Part D prescription drug plan, and those three elements together comprise what we call original Medicare. If you opt for original Medicare, Medicare is going to cover 80% of your healthcare costs, and you're going to be responsible for 20%. That's where the Medigap policies come in. Medigap policies, there's a whole bunch of different ones out there. Depending on which plan you choose, it's going to cover all or part of your 20% of those covered benefits. So with original Medicare, generally speaking, you're going to have higher monthly premium costs because you're going to have a premium for Medicare Part B. Right now in 2022, that premium is $170.10. You're going to have a premium for your Part D prescription drug coverage, and you're going to have a premium for your Medigap policy. So generally speaking, I would say you can count on, $300 to $350 a month for your premium costs if you opt for original Medicare. So you're going to have a higher monthly cost for your coverage. The good part about this type of coverage is that when you actually go to get care, you're going to have low to no out-of-pocket costs. You're going to have to meet your Medicare Part B deductible, which is $233. And after that, depending on which Medigap policy you choose, it's going to pay all or whatever percentage of your 20%, leaving you with low to no out-of-pocket costs. The other thing that people like about Original Medicare is that it has the most freedom of choice with providers. There is no network if you're in Original Medicare. With Original Medicare, you can see any doctor that you choose in the country who accepts Medicare. You don't have to get referrals. You don't have to get approvals. If the doctor accepts Medicare, you can go there. So for people who are planning to travel a lot, or people who in retirement think that they're going to spend significant amounts of time in other parts of the state or other states visiting family or friends, this is a really good choice because you're not going to have to worry about if your insurance is going to cover it if you're in or out of network. The other type of coverage is a Medicare Advantage plan. With a Medicare Advantage plan, you still have Part A and Part B. Those are your basic building blocks of Medicare, and no matter which type of coverage you opt for, you're going to have Part A and Part B. But in a Medicare Advantage plan, those are bundled together along with a prescription drug plan into an insurance policy that's offered through a third-party insurance company. And there's a ton of them out there. Humana, Molina, Presbyterian, United Healthcare, Blue Cross, there's a lot of them. Each Medicare Advantage plan is going to have unique benefits and co-pays. It has to cover at least what Medicare covers. It can cover additional benefits. So, for example, with Original Medicare, there is no vision or dental coverage. They just voted to include hearing coverage, but there's no vision or dental. So if you want vision or dental coverage, you have to enroll in a separate plan, or many people find that, they just pay for those costs out of pocket. With a Medicare Advantage plan, often there is some amount of vision and dental coverage included. They advertise heavily on this. I am sure all of you have already started getting a ton of mail about it from the Medicare Advantage companies trying to sell you their plan, and they advertise heavily on the vision and dental coverage. I really recommend that you look in depth at the details of whatever plan you're considering, because you're not always getting what you think you're getting. So you have to make sure you really understand your coverage if you're opting for a Medicare Advantage plan. And that is one of the services that we offer in the SHIP program. We're licensed, or not licensed. We're fully trained Medicare counselors, and so we can go through the plans with you and make sure you understand the coverage. With this type of coverage, with the Medicare Advantage plan, you're going to have lower monthly premium costs. So you can count on your Medicare Part B premium, which, as I mentioned, is $170.10, plus whatever the premium is for your Medicare Advantage plan. And they vary wildly. They're all over the place. You can get a Medicare Advantage plan for anywhere from a $0 additional premium, where it doesn't cost you any extra money to have the Medicare Advantage plan, all the way up to over $200. It just depends on which plan you opt for. An important thing to know is that if you go for a Medicare Advantage plan, you can't also have a supplement. It's an either-or situation. So if you want a supplement or a Medigap policy, you have to have Original Medicare. If you opt for a Medicare Advantage plan, you can't have a supplement. The flip side of the low monthly premium costs for Medicare Advantage plans is that you are going to have out-of-pocket costs anytime you get care. So every service in a Medicare Advantage plan has a copay, and those are set by the plan. They can change yearly. Um, and so you're going to have higher out-of-pocket costs. Now, if you've got low healthcare needs, that may be an easy trade-off. If you have high healthcare needs, it may be more cost-effective to go with original Medicare with a supplement. It really just depends on your situation. And after talking to a whole bunch of people about this, there's a really strong, I think, psychological component to what's going to lead to your satisfaction with your type of Medicare coverage. Some people really want to just pay their premiums and know they're not going to have to worry about it. Like if you get hit by a bus and you end up in the hospital, some people just really like knowing that you're not going to have to worry about big bills or out-of-pocket costs if you have original Medicare with a supplement. And also, if you really are the type of person who wants to be able to research, if you come down with a health condition, you want to research the best place to get treatment for that and just be able to go there without having to, fight with your insurance company, then original Medicare with a supplement might be more satisfying for you just based on those needs that you have for your coverage. If, on the other hand, you don't mind staying within a network and you don't want to be paying for healthcare that you may or may not be taking advantage of with those high monthly premiums because you go to the doctor once a year or not even that, and so you don't want to be paying a bunch of money out for healthcare that you're not receiving, a Medicare Advantage plan may work better for you. The really important thing to understand about this initial decision is that you may have more trouble getting a Medigap policy, and it may be more expensive if you decide to change from a Medicare Advantage plan to original Medicare with a supplement at a later date. When you first go on Medicare, you have what's called a right of guaranteed issue period for the Medicare supplements or Medigap policies. And what that means is if you want to enroll in a Medigap and you're in your initial enrollment period, they can't turn you down. They can't ask for a health screening. You just call them up and say, I want this plan, and they have to issue it to you. Okay. If you in 5 years decide, you know what, my healthcare needs have risen, I think I'd be better off now with original Medicare with a Medigap policy, and you try to enroll in one, and you're at that point, you no longer have a right of guaranteed issue. The companies that issue those policies can require a full health screening. They can decline you based on pre-existing conditions, and they can charge you more based on your health conditions and your age. So if you're thinking that original Medicare with a Medigap might be the best type of coverage for you, I really recommend that you do it right away, because I've worked with people who literally have not been able to get a Medigap policy because of their health conditions. Does anybody have any questions right now?
No.
It's kind of confusing still, but compared to cost of living, how is somebody going to be able to pay for anything? Because you spewed off premiums as if people have money.
So we'll talk some more about some of the Medicaid programs that help defray Medicare costs for people on limited incomes, because there are some programs that help pay the Medicare Part B premium. But it's important to know what, for your budgeting purposes and for your decision-making purposes, what kind of costs to expect, because that does really play into the decision-making process for a lot of people. That's why that is one of the reasons why so many people have Medicare Advantage plans, because it is less of a hit on your monthly budget. But we will be talking about some other programs that help with the basic Medicare costs a little bit later in the workshop. For now, what I want you to understand is kind of the differences in the way your coverage is going to work if you go with original Medicare versus a Medicare Advantage plan. Does anybody have any questions about that right now?
No.
No,
Okay. So basically, now we're going to dig into what exactly each piece of the building blocks here covers. If you have Medicare, for Medicare Part A, that's the hospital insurance. It covers your inpatient hospital stay, skilled nursing facility, blood, home health care. And by home health care here, we don't mean personal care services like a caregiver who comes in to help out, but rather this is skilled nursing, occupational therapy, physical therapy, wound care, some care that your doctor has ordered and that is provided in your home. Part A also covers hospice care. Most people don't have a premium for Part A. If you paid in to the system for at least 10 years or 40 quarters, Part A is going to be free. If you didn't pay your FICA taxes for at least 10 years, then there is a premium. Most people that I've worked with who don't qualify for free Part A have either worked in a non-traditional occupation that didn't pay into taxes, or were disabled very young and not able to work. In either of those cases, if somebody finds that they're not eligible for free Part A, they can call us and we'll assist to see if they may qualify for a program that'll help pay for that. It's not something that you want to try to work through on your own. And so if you or anyone you know is in that situation, please have them give us a call so we can help with it. There is a deductible for Part A. The deductible is $1,556 per benefit period. So if you're hospitalized and you have original Medicare, before your supplement kicks in and starts paying your 20%, or I'm sorry, that's not true. If you have original Medicare, you're going to have to spend the first $1,556 out of pocket. And that goes pretty quick in a hospitalization. And the important thing to know about the deductible is it's not a yearly deductible. It's a deductible per benefit period, and you can have multiple benefit periods in a year. So your benefit period starts when you're hospitalized, and it extends for 60 days after your hospitalization ends. So if you go into the hospital for a week and you come out and you go back a month later, you're still in that initial benefit period and you don't have to pay the deductible a second time. But if you're hospitalized in January and you go back into the hospital in July, you're in a new benefit period and you're going to have to pay the deductible again. This is one of the big reasons, if you have original Medicare, a supplement is a good idea, because most of the supplements pay your Part A deductible, so that's not going to be an out-of-pocket cost for you. With the Medicare Advantage plans, the Advantage plan may have its own deductible, right? And there are going to be daily copay costs for your hospitalization. So the deductible doesn't work quite the same with a Medicare Advantage plan. But, it's going to work out to be roughly the same amount, generally speaking. Okay. As I mentioned before, if you didn't qualify for free Part A, you can get Part A for a premium. The premium is very expensive. I don't remember what it is exactly off the top of my head, but it's it's over $400 a month. If you don't enroll when you're first eligible, and you decide to enroll later, there will be a penalty. You may be able to get free Part A if you qualify for Medicaid, a partial Medicaid program. As I mentioned before, we're going to discuss those in a few minutes. Please give us a call and let us help you with that if you find yourself in that position. Okay. Before we move on to Part B, does anybody have any questions about Part A, hospital coverage?
No.
No.
Okay. Part B is the part of your Medicare that covers doctor visits. Doctor visits, outpatient surgery and supplies, your labs, x-rays, MRIs, CAT scans, EKGs, durable medical equipment like wheelchairs, oxygen, any kind of equipment that you need. Diabetic supplies like the test strips and the needles are covered under Part B. They're not part of a prescription drug plan. They're actually covered under Medicare Part B. And there's a variety of preventive services that you're eligible for with Part B that are generally free. In 2022, as I've mentioned a number of times already, the Part B premium is $170.10. The deductible for Part B is $233. If you have original Medicare, you're going to have, as we mentioned, Medicare pays 80% and your part is going to be 20%. If you have a supplement along with your original Medicare, then your supplement's going to cover your 20% here. If you have a Medicare Advantage plan, you're going to have a set copay for each service that you receive. Many preventive services offered by Medicare have a zero copay. Generally speaking, you're going to have a 20% coinsurance for outpatient mental health services, and also for hospital outpatient services. Somebody called me the other day and said, mental health isn't covered by Medicare. And I'm like, who told you that? Of course it is. So it's important to know that counseling and that therapy is covered by Medicare. And durable medical equipment also has that 20% coinsurance, or if you're on a Medicare Advantage plan, you're going to have a set copay. It can't exceed 20%, right? That's the important thing about the 20%, no matter which type of coverage you opt for, is that if you're on an Advantage plan, they can't charge you more than 20%. They can and sometimes do charge you less, but it can't be more. Okay, so for basic Part B coverage, before we move on to enrollment, does anybody have any questions about that?
No.
Not yet.
Okay. So if you're eligible for your Part B enrollment, there are some situations where you may be considering opting out or delaying enrollment. You really should consider that only if you're covered by your own or your spouse's active employer insurance. Okay, not retiree insurance, not COBRA. It has to be either your own or your spouse's active employer insurance. They're still working and covered by their employer. And it needs to be a primary insurance. The employer has to have more than 20 employees. COBRA is not considered active employer group insurance. So if you, and I've worked with people who are like, I have COBRA, so I don't need to take Medicare now. You will expose yourself to lifetime penalties if you don't enroll when you're first eligible and you don't have creditable coverage. Retiree coverage is also not creditable coverage, right? And if you're through the New Mexico Retiree Healthcare Authority, you can't continue your retiree. They switch you over onto Medicare, right? TRICARE for Life other insurances, once you turn 65, require Medicare to be the first payer, right? So even if you have other coverage, you need to enroll in Medicare. You don't want to expose yourself to a Part B late enrollment penalty. The premium is 10% for each 12-month period. So if you enrolled in Medicare a year late, that's going to be an additional $17 a month added on to whatever the base premium is forever. Forever. It's a lifetime penalty. Okay. It's not so bad for 1 month, but if you, 1 year, but if you miss 2 years, it's 34. Once you've missed 10 years, your premium doubles, right? So we really want to help people know how important it is to enroll during that initial enrollment period. Plus, you're going to have gaps in coverage, which just, isn't good for anyone. There is a Part B special enrollment period for people who delayed enrolling in Medicare Part B because they continued working and had active employer insurance. You have to get enrolled in Medicare within 8 months of losing or of retiring or ending your active employer insurance. And if you do that, there are no penalties. If you want to buy a Medigap policy, remember I went over that whole bit about the initial right of guaranteed issue period for the Medigap policies. If you want a Medigap, you're probably going to be better off just enrolling when you're first eligible in Medicare, and that way you have that right of guaranteed issue. Often people find that Medicare is actually more cost effective than staying with their active employer group health plan. So people often, even if they continue to work, go ahead and get on Medicare because it's going to save them money on their healthcare costs. If you have or will have TRICARE for life, you must be enrolled in Medicare. TRICARE won't pay unless Medicare pays first once you're eligible. And sometimes an employer or a retiree plan actually requires you to switch over to Medicare when you're eligible. And that coverage will continue as like a supplement, but Medicare has to be first payer. So if you're considering opting out of Part B, you want to have a really in-depth conversation with a SHIP counselor, with the HR person or the benefits person, with your employer or with your retiree plan before you make that decision, because we don't want to see you exposed to gaps in coverage or penalties. Okay. The third building block, if you're opting for original Medicare, is a Part D prescription drug plan. This is your prescription drug coverage. It's offered through a third-party insurance company, and it's kind of separate from the A and B because A and B stays the same. But you can change your Part D prescription drug coverage yearly, or even more often if you qualify for Medicaid. We'll talk more about that later. Based on your drug costs and your needs. So there's a whole bunch of different prescription drug plans available. They're going to depend on the area where you live, which plans are available to you. They cover drugs differently based on their formularies, based on the plan parameters that they have set up. You have to have either Medicare Part A or Part B. You don't have to have both, actually, in order to sign up for a Part D prescription drug plan. As I mentioned before, there are going to be different plans available depending on your area. This is another situation where if you don't enroll in a prescription drug plan, you're going to be exposing yourself to penalties. I've worked with lots of people who said, I don't have a prescription drug plan. I don't take any drugs. right? So I don't need one. And I like to remind people that during a global pandemic is really not a good time to be underinsured. And we get insurance not just for our current needs, but for needs that may come up unexpectedly, right? People get sick, people have accidents. And so you really need to have that prescription drug coverage, even if you may not take many medications or your medications aren't very expensive. Part D plans, the premiums vary wildly. They're all over the place. And which plan works best for you is going to depend a lot on which medications you take. And you really have to look through the plans. And as I mentioned before, I'm going to show you the plan finder on Medicare.gov in a little bit. You input your drugs into there, and it's going to show you how the various plans are going to cover your medications, whether they're on the formulary or not, and what kind of copays you can expect for the specific plan you're looking at. The Part D plans can have a deductible up to $485 a year. Again, the plans vary wildly. They're all over the place. Anywhere from a zero deductible up to the full $485 deductible. It varies. The monthly premiums vary wildly too. I think the lowest premium I've seen for 2022 plans is somewhere around $8 a month, right? It's not very much, but they go all the way up to over $100. And which plan is right for you, you can't just look at the premium. You really have to look at how it covers your specific medications, because sometimes a plan with a higher premium is going to cover your drugs better and actually ends up costing you less when you look at all those premium and copay together. And again, the copays and coinsurance for your medication is just, it's extremely individual to the plan. So the SHIP program, we offer counseling on this, and we can go through it all with you and make sure you understand what to look for in a plan and how to evaluate whether a plan is right for you. We're happy to help you with that. You can also go on Medicare.gov and go into the plan finder yourself. People also work with an agent or a broker. I recommend really understanding it before you work with an agent or a broker, because that way you'll know what your priorities are, and then you can make sure that the plan you get meets those. If you don't enroll in a Part D plan and you decide later to do so, there will be a penalty. It's 1% of the national base premium for each month that you weren't enrolled. So with Part B, the premium is a year by year thing. With the prescription drug plan, it's a month by month thing. So 1% of the national base premium of $33.06 is 33 cents a month. So if you've gone a few months without prescription drug coverage, I worked with somebody who was in this situation. She enrolled in Medicare and didn't know she needed to enroll separately in a Part D prescription drug plan. And so she went 5 or 6 months without that coverage before she was able to get enrolled during the open enrollment period in the fall. And it was, 33 cents times 6. It wasn't very much. So she was happy about that. But if you go 10 years, that's a much bigger penalty. So you can see that if you go 2 years without coverage, your penalty is going to be an additional $7.92 a month. Right. So you just want to, knowledge is power, and you can avoid these penalties if you understand the consequences of not enrolling, and you can choose with full knowledge of what those consequences will be if you decide not to get enrolled in a Part D prescription drug plan. What we're trying to avoid here is surprises. Okay, before we move on to talking about Medigap policies, does anybody have questions about Part D prescription drug coverage?
no,
No, not yet.
Okay. All right. So if you do opt to go with original Medicare and you want to enroll in a Medigap policy, they're also referred to interchangeably as Medicare Supplements. These plans are there to cover your 20% of costs that Medicare doesn't cover. Okay. They do not cover anything additional. If Medicare pays their 80%, your Medigap policy is going to cover all or part of your 20%, depending on which policy you choose. It is not going to cover anything Medicare doesn't cover. So it doesn't include dental, vision, hearing. It doesn't include any additional benefits. It only covers your part of what Medicare already covered. A lot of people have misconceptions about these. You do not have to worry about a network. So for example, if you have original Medicare and you have a Blue Cross Blue Shield Medigap policy, your provider does not have to accept Blue Cross. Okay, people get confused about this all the time. You go, Medicare pays, Blue Cross pays secondary, right? Your provider does not have to accept Blue Cross, right? Because that's only for Medicare Advantage plans where networks apply. They do not apply for Medigap policies or supplements. And the supplements are offered by just quite a range of insurance companies, some of whom we think of as health insurance companies like Blue Cross or Presbyterian or United Healthcare. But many who don't, Colonial Life, or there's just a whole bunch of different ones. And so you don't need to worry about, will my doctor accept whatever company offers the Medigap plan? That's not a thing. Does anybody have questions about the Medigap policies?
you did say that the dental and vision is not covered under that?
The
Right?
supplement does not cover anything like that. It covers your part of what Medicare already paid.
Is there something that will cover all that or no?
If you want a dental or vision coverage, you can either purchase a separate standalone policy. And if you're going through the Retiree Healthcare Authority, they offer those, right? So you can continue with a dental and vision policy that you already have through the Retiree Healthcare Authority.
Okay,
Or you can join a Medicare Advantage plan,
okay.
right? But it's not included in original Medicare. Okay, so this is kind of what it looks like. And this is just a couple of screenshots from Medicare.gov. There's a chart, there's a really handy little chart here that shows the Medigap plan identifier across the top. And it's a little bit confusing because they use some of the same letters of the alphabet as your base Medicare coverage. But there's an A, a B, a C, a D, an F, a G, K, L, M, and N are the different types of Medigap policy you can purchase. Each of them is going to have, different benefits. Down the side are the benefits that can be offered in a Medigap policy. Part A coinsurance and hospital costs. Remember, I was saying how, your the deductibles down here. So that would be your 20% of a hospital stay, or your 20% of a hospital stay with original Medicare, which can be a lot. All of the plans cover it. So they each have a yes here. Part B, your doctor visit coinsurance, that 20%. A, B, C, D, F, and G. Yes means they cover your full 20%. So you should have no out-of-pocket costs when you go see the doctor. If you opt for a K supplement, it's going to cover half of your 20%. And what that means is, let's just say a doctor visit costs $100. Medicare is going to pay $80. You're responsible for $20. If you have one of the policies that has a yes in this, it's going to pay your full $20. If you have the K plan, it's going to cover half. So it's going to pay $10 and you're still going to have to pay $10. If you have an L plan, it pays 75%. So again, Medicare pays $80, you're responsible for $20. Your L plan is going to pay $15 and you're going to have to pay $5. Okay, so that's what these percentages mean. It means these plans don't cover your full 20%, they cover a part of that, and then you're still going to have a copay. Okay, so there's blood, Part A hospice, coinsurance. People aren't thinking about it when they first turn 65, but let me tell you, when you get to that part of life, that's a really important benefit. Skilled nursing, same thing. A lot of times people aren't thinking about this. Personally, I think this is a crucial benefit because 20% of a day in a skilled nursing facility is expensive. And you never know if you need a knee replacement or a hip replacement, you may very well end up in a rehab, getting your physical therapy while you get back on your feet. And a plan that covers that for you is really important. Here's the Part A deductible that we talked about before, that $1,559 per benefit period. If you have one of these Medigap policies and there's a yes in this column, that's going to be covered for you, right? You're not going to have that out-of-pocket expense. Your supplement's going to pay for it. Part B deductible, the same. The Part B deductible is only $233 a year. Most of the plans don't cover it, but it's not the same kind of big ticket item that a Part A deductible is. So personally, I wouldn't select a plan just based on that because it's a relatively minor cost. But so you can see, when I'm helping somebody consider Medigap policies, the first thing we do is spend some quality time with this chart to find out which benefits are important to you. And that's going to really narrow down which plans you need to look at in more detail. Does anybody have any more? And if you're through the Retiree Healthcare Authority, there's only one plan available. It's a G plan. And this is interesting, okay? If you start looking into Medigap policies, the premiums are all over the map, right? They vary wildly. But the plan is going to cover the exact same benefits. A Plan G is a Plan G. You do not get more benefit based on the premium that you're paying. There are some really important things to consider about the premiums. There are 3 different pricing structures for the premiums for the Medigap policies. One type of pricing structure is called community pricing. With community pricing, everyone in the plan pays the same price. And the Retiree Healthcare Authority is a community-based pricing structure. So everybody pays the same price, regardless of when they entered the plan. The reason the premium through the Retiree Healthcare Authority is pretty high compared to other plans that you can get off the shelf. The reason it is so high is because people can go in and out of the 2 types of coverage without having to go through underwriting, right? So if you're getting your coverage through the Retiree Healthcare Authority, you can start out on a Medicare Advantage plan, keep your costs low. Later, if you decide, you know what, I think I would rather have original Medicare with a supplement, during the Retiree Healthcare Authority's change switch enrollment period, you can switch to original Medicare with a supplement without having the threat of being denied. You can just change into it. They allow that. And that's part of the reason that that plan is more expensive, right? But that's a fantastic benefit. To be able to stay with an Advantage plan while that meets your healthcare needs, and switch into Original Medicare with a Medigap policy when your healthcare needs change is a really nice benefit that you don't get outside of an organization like that. The other type of, there's two other types of pricing structure. The first is called attained age. Most plans by far that are available in New Mexico are attained age policies. And with these policies, the price, your initial premium is based on the age you are when you enroll in the policy, and your premium is going to go up every year. So what happens with these is they start out with the lowest premiums, but after 10 or 15 years, often the premium has gone up so much that people just can't even afford them anymore. Okay. It's really important to understand how that pricing structure works and not just choose a plan based on that initial premium that you see, but to think about how that premium is going to change over the life of the policy. The third type of premium is called issue aged, and the premium is based on the age you are when you buy the policy, and it's not going to change. It's going to stay the same throughout the life of the policy, aside from minimal cost of living increases, right? Plans can increase their premiums, but whereas with an attained age policy, you can expect a substantial increase in premiums every year. With an issue age policy, it's going to be minor cost of living increases. So those are some things to think about if you're looking at Medigap or Medicare Supplement policies. And if you need help with this, again, we can help. We have access to a Medigap plan finder that is not publicly available, and we can get you actual accurate pricing information for the Medigap policies that are available in New Mexico. Does anybody have any questions about this before we move on?
It's just gone over my head and it's very scary. So I don't know what to say or what to ask.
Well, Robert, as I mentioned before, you're welcome to call me. We'll set up an appointment and we'll talk in more detail about your situation. Now that you have some of these basic building blocks, and I hope that it hasn't scared you more than you were before. But because, knowledge is power, right? So I don't know if it's the coverage that's scaring you or the costs.
It's the cost, because knowledge doesn't pay your bills, doesn't pay your food,
right,
and doesn't pay your gas.
So I don't want you to talk about any of your personal financial information now during this workshop, but if you want to go over that with me, please do give me a call and we'll set up an appointment, okay?
Okay.
Okay. All right. So that what we've gone over to this point is basically Original Medicare. And now we're going to go into a little bit more detail on the Part C Medicare Advantage plans. So a lot of times people will tell me, no, I don't have Medicare. I have United Healthcare. I have Presbyterian. And it's just so important to remember that this, in fact, is your Medicare coverage. You're buying it through a third-party insurance company, but it is still Medicare. Most Medicare Advantage plans include Part A and B and D. Some don't have a prescription drug plan. So you have to be careful if you're looking at them to make sure your prescription drugs are going to be covered. You must have both Part A and Part B to join a Medicare Advantage plan. These are also very regional, so different plans are going to be available in different areas because they're based on networks of providers right? So what plans are available are going to depend on whether there's a provider network for that insurance company in that area. Okay. There is a deductible for Part C. Every plan is different. So it's hard to talk in generalities about costs with Medicare Advantage plans because they're all going to be quite different. The monthly premium that you can count on with a Medicare Part C plan is your Part B premium. Everyone always, if you have Medicare, you're going to be paying the Part B premium. There may be an additional premium that's charged by the Medicare Advantage plan, but it varies from plan to plan. Each plan also has set copays and coinsurance for each service, and there's a lot of variation. Plans are really different. For example, for a primary doctor visit, some plans have a zero copay and some go up to, $40 or $50 copay per visit. They're individual. During Medicare's fall open enrollment period, which comes every year from October 15th to December 7th, that's the opportunity to shop around and change plans. You can do this with your Part C Medicare Advantage plans. You can also do it with your Part D prescription drug plans. Sometimes, plans have the opportunity every year to change their coverage and to change their drug formularies. And it may be that a plan that's been working for you just fine changes something, or your health needs change and it's no longer working for you. So the open enrollment period every fall gives you the opportunity to look at what's available and shop around for something that's going to meet your needs better. Our office helps people with this every year. We do Medicare open enrollment counseling from October 15th to December 17th. That's pretty much all I do, is help people look at plans and enroll in a plan that's going to better suit their needs, save them some money. So there's different types of Medicare Advantage plans. Most of the plans that are available in New Mexico are either HMOs or PPOs. HMO stands for Health Maintenance Organizations. HMOs tend to have a smaller, more local network of providers. PPO stands for Preferred Provider Organization, and these tend to have larger, more extensive networks that are regional, statewide, even multi-state or national. So, and they also, PPOs tend to have a higher monthly premium because you have a bigger range of doctors available to you. We don't have very many or private fee-for-service plans available in New Mexico, or MSAs, Medicare Savings Accounts. We do have a number of special needs plans. Special needs plans are for people who have both Medicaid and Medicare. And we're almost to the point, Robert, hang in there, where we're going to talk about Medicaid and how some of the cost savings with Medicaid. So a Medicare Advantage plan has to cover at least what's required by Medicare Part A and Part B. It cannot cover less than original Medicare, but they may include additional benefits such as, the prescription drug coverage, which you want to make sure you have, vision, hearing, and dental. There's also a variety of other kinds of value-added benefits that they add on. Many of them have an over-the-counter drug benefit. They may have a gym membership. There can be transportation included as part of the benefits. So it varies a lot from plan to plan, but there can be a variety of additional benefits beyond the vision and dental. Okay, does anybody have general questions about the Medicare Advantage plans before we kind of move on?
No.
No.
Okay. All right, so here's the Medicare and You. I want to point out that on Medicare.gov, There's a ton of information available. And I think I'm going to go ahead and stop sharing and just get onto the Medicare.gov website for a second and just give you a tiny little tour of that. Would you guys like that?
I guess so.
All right, let's try it. Let me go here and share a different screen. Make sure I have it up. This is a little spur of the moment for me, so bear with me for just a sec while I get that going. All right. There we go. I knew I had that up. Okay. Close my little extra thing here. So when you go on Medicare.gov, it's really important that you just go to www.medicare.gov. For heaven's sake, do not ever just Google Medicare. That is a nightmare of epic proportions, and it's going to expose you to a lot of fraud potential, right? So if you're looking for information about Medicare, the only place to go is www.medicare.gov. And they've recently redesigned, like within the last couple of weeks, the website so that it looks like this. There's the lady. One of the things that I'd like to point out to you, first thing, is this Get Started with Medicare button. That's the first thing that you see here. And if you click on this, can you see there's a couple with wearing red shirts, clicking their teacups? This is a great place for people who have just started Medicare to get more information, because they have information about the Medicare basics, more information in a slightly different format about the parts of Medicare, which we've gone over today, the general costs, how Medicare works, what if you're continuing to work past age 65, how to sign up, how to get more coverage, and what to do, how to use your Medicare, right? Information about your Medicare card, how to get services, 5 tips for using Medicare, and other helpful tools. So I really recommend that if you're just starting out on Medicare, you spend a little time here because there's a lot of great information. Okay, I'm going to go back over here to the main. I do recommend that people create an account on Medicare.gov. It's a really handy tool. All your information is there. Any letters, your Medicare summary notices, information about your current coverage. It's all going to be accessible through your Medicare.gov account. What I want to show you right now is just a little quick trip into the Medicare Plan Finder. So if you're looking for coverage, you don't have to get help from a SHIP program, somebody like me, or from an agent or broker. It's all readily accessible right here on the Medicare.gov website. You can just click on the Find Health and Drug Plans button, and it will take you into the Medicare Plan Finder. I'm going to just go in here real quick. Am I only entertaining myself, or are you finding this useful?
It's useful to me.
Oh, all right, good.
It's useful. So
All right. So if you have an account, you can log in to your account, and it's going to have your information already there. We're not going to do that today. We're going to continue without logging in. You can always do that too. And I'm just going to click on a Medicare Advantage plan. Let's look at that. And I'm going to use 87505. You put in the zip code because, as we mentioned before, these plans, you have to be in their service area. I'm going to say we don't get any extra help. And you just click along. You always want to say, yes, you want to see your drug costs when you compare plans. And I'm just going to put in 2 pretty common medications so that you can see how this works. Click next, and I'm going to put in lisinopril. Right? I just start typing it. It populates. I click on the drug here, add drug. I'm going to not change anything. I'm just going to use that sort of standard dosage. Put it there, and I'm going to add another drug. I'm going to add levothyroxine. Levothyroxine, common medication. Okay, there we go. So I'm going to just leave it at that, done adding drugs. The next thing it's going to do is ask you to add your pharmacy. I really recommend, there's space to put in 5 pharmacies. I always fill them up. There can be wildly different drug costs based on the pharmacy for each plan, because each plan has preferred pharmacies that they work with. So I always add the mail order. And then I'm going to put in Walgreens. Let's do Christus, Smith's. That's 4, one more, and Albertsons. Right? I always ask people where they should get their groceries and put that on, because you never know. It's really interesting to see the difference in prices based on the pharmacy. When you do this, you're only comparing costs. You're not committing to going to a particular pharmacy, right? We haven't even put any information. They don't know who we are. Okay, and now it's going to load them up, and we can see the different plans that are available in this area. I always go under plan benefits, and I want to make sure that there's vision, dental, and hearing coverage. So I'm going to apply that. And I also always want to make sure that there's drug coverage. I don't want to even look at plans that don't include drug coverage. So I apply that filter. And now there are 31 Medicare Advantage plans available in this zip code. Right? The first one is a Medicare Advantage plan. It's a PPO. It's a AARP working with United Healthcare. There's a 0 additional monthly premium. So if we were to enroll in this plan, we'd be paying the $170 a month for Medicare Part B, but we wouldn't have any additional premium. It has a 0 health deductible and a 0 drug deductible, right? We got some basic information just here on this page. Primary doctor visit has a $10 copay. Specialist has a $45 copay. And if we want to look in more detail, we click on the blue plan details button. And it's going to go into a lot of depth about the various coverages. Primary doctor. This one has for diagnostic tests and procedures, there's a $25 copay. For lab services, there's a 0 copay. MRIs are going to cost, the copay is going to be anywhere between $0 and $115. X-rays are $15. There's a $90 copay for emergency care, urgent care, and we can go through all of the services and copays for this plan by going through the plan details. So you can see there's a lot of information available. I don't want to spend too much time going through this, but you can see that you can really get a lot of information from Medicare.gov without inputting any personal information at all besides your zip code. Okay, so I'm going to click back on the Medicare.gov. Often when I do Medicare counseling for somebody who's looking for health and drug plans, we'll go along and we'll do this together. And if they have a computer and they feel comfortable with it, I'll talk them through so that we're both looking at the same thing at the same time. So underneath that, here is get help with Medicare costs. Right? We're going to go over this again in the formal workshop, but I think this is super, super useful. So And again, this is just on the Medicare.gov website. This is on the first page that you see when you go there. You just scroll down a little bit. There's a button to check savings programs. So let's go there next because I know that this is a concern. Medicare savings programs is a partial Medicaid benefit. You apply for it here in New Mexico on the Yes New Mexico website, or you can get an application at any ISD office. There are 4 levels of benefit within the Medicare savings program. Okay, so, and they're based on your monthly income. I'm going to start down here with a qualifying individual. If you look on here, it's going to tell you that the Medicaid, this partial Medicaid program looks at income and assets. Here in New Mexico, eligibility is based on income only. There is no asset test, right? So ignore that part. If your income is $1,549 or less a month, you are likely to qualify for this benefit called QI1. This benefit pays your Medicare Part B premium for you. So that $170 a month will be paid by Medicaid if you will qualify for QI1 rather than being taken out of your Social Security check. Okay, so this is a way to keep Medicare affordable for people. If your income is $1,379 or less, you're going to qualify for specified low income Medicare beneficiary, or SLIM-B, that's what we call it in the lingo. This benefit also pays just your Part B premium. And if your income is $1,153 a month or less, you're going to qualify for Qualified Medicare Beneficiary, or QMB. This partial Medicaid benefit pays your Part B premium, and it also pays any deductibles, co-pays, or co-insurances. So if you have QMB, you should have no out-of-pocket costs for your medical care. If you have SLIM-B or QI1, your Part B premium is going to be paid so that it doesn't get taken out of your check, but you're still going to have co-pays or co-insurances. And in order to get, this is just the basic information about these programs. In order to get more details, you can call us at the Aging and Disability Resource Center, or you can go to Yes New Mexico or your local ISD office. Okay, so that is just our very brief tour of the Medicare.gov website. Thank you for indulging me. And do you have any questions before we go back to our regularly scheduled broadcast?
No.
No,
Okay. So I am going to start back up where we left off. Okay. You can, so are you seeing the Medicare and You slide now?
yes,
Yes.
Okay, good. I just always like to check because sometimes I think it's working and it's not. So you can actually have access to the Medicare and You handbook from the Medicare.gov website. So you probably, generally speaking, when you enter your initial enrollment period, Medicare sends these out unless you sign up to get it electronically instead, in which case they'll email you a PDF of it. But if you're before your initial enrollment period, you might want to go on Medicare.gov and either look at it online or download it so that you can spend some time looking at it. It's another way to make sure you understand how Medicare works and have all this information at your fingertips. All right, come on now. All right, and I just included a screenshot of the Medicare and the information on Medicare.gov where we just visited. So again, we discussed this briefly when we were looking on the website, how Medicare works with Medicaid. The main program is the Medicare Savings Program, and this is a partial Medicaid benefit that covers Medicare premium costs for limited income beneficiaries who qualify. As I mentioned, here in New Mexico, eligibility is based only on income. They don't even ask any questions about your assets. And you can apply online at www.yes.state.nm.us. You can also call the Aging and Disability Resource Center at 1-800-432-2080. You can either ask for assistance from the options counselors who answer the phone, or you can request to speak with a SHIP counselor. I do these applications online for people all the time. It is quick and easy. It takes, even with having to set up an account on Yes New Mexico, it'll take us less than 15 minutes. If you do it yourself, it's very easy to do. I highly recommend it because if you can save that $170 a month for your Part B premium, there's just no reason at all not to do that. The other main way that Medicare works with Medicaid is through the waiver programs. There are two waivers. The first one is called the Home and Community-Based Waiver, and this is a full Medicaid program for people who need in-home caregiving services. Way back at the beginning, we talked about how Medicare Part A pays for home health, but it's not caregiving services. It's just skilled nursing that's been prescribed by your doctor, like wound care, physical therapy, occupational therapy. So for people who need caregiving services, somebody to come do light housekeeping, cooking, help them bathe, run errands, and kind of just provide some company and some oversight, that's not covered by Medicare. In order to get those kinds of services covered by a benefit, you have to apply for this home and community-based waiver. You have to start the application process through the Aging and Disability Resource Center. You cannot apply for it directly from Medicaid. So that's one important benefit. This is basically, these are the only ways that a person can get a full Medicaid benefit in addition to their Medicare. And you have to meet the level of care requirements in addition to the financial eligibility requirements for both of these programs. The institutional care waiver is the other waiver program, and it is for people who are in a skilled nursing facility. You have to actually be in the skilled nursing facility before you can apply for it. This one you do apply for directly from Medicaid, and usually the social worker or the staff there in the institutional setting, the skilled nursing facility or whatever facility it is, will help with this application. But if you need information about it or assistance, you can always call the ADRC. And that number again is 1-800-432-2080. Before we move on, does anybody have questions about either the Medicare savings programs or the waiver programs?
No.
No.
Okay. All right. So I highly recommend spending a little bit of time with the Aging and Long-Term Services Department website. You've both been there already, I know, because that's how you got into this event under news and events. Upcoming workshops and other things are listed under news and events. The Medicaid waiver information you can get online here with this button. You still have to call to register, but you can get more information about it here. And there's a variety of programs that are under Aging and Long-Term Services that you can get information about on our website. You can also get to videos about a variety of topics on our website. If you scroll all the way down to the bottom, and I didn't take a picture of that part, there's a YouTube icon, which is a little rectangle with a triangle in the middle. It looks like a VCR play button. And if you click on that, that'll take you to our YouTube channel, and you'll find a variety of video resources there, including tomorrow, the video of this workshop. If you reach out to the Aging and Disability Resource Center, you're going to speak with an options counselor. Basically, the Aging and Disability Resource Center is the statewide call center for the Aging and Long-Term Services Department. And people can call us and ask about anything under the sun, and we will try to connect them with the resources that they're looking for in their local area. The person that you speak to is called an options counselor, and you can ask any question that you have. We don't always have the answer immediately, but we can get you going on the right path to get whatever information or assistance you're looking for. Often people, as you're aging, you face new situations all the time, and you don't necessarily know where to turn for help. I've talked to so many people who've spent months trying to get the information or the help that they're looking for and been bounced around from person to person, and finally reach us. And, we get them started on the straight path right away. I worked with a woman last week who had been trying to get a problem resolved for 3 months, and we got it taken care of in 2 phone calls. So I also talked to somebody who said, it never occurred to me to ask Aging and Long-Term Services because I didn't think that applied to me. She was in her 70s. I love that, first of all. But second of all, it's really important to know that there's just a really wide variety of resources available. And it's not just about nursing homes. We offer, as I've mentioned, a variety of short-term assistance, and all of the SHIP information, anything. If it has Medicare in it, call us, right? We'll help. There's also a prescription drug assistance program that you can access through our office. Even with insurance, often people find that they have drugs, the copay is so high that it puts it out of reach for them. And we really don't want anyone rationing their medication or not taking it as prescribed because they can't afford it. So if you find yourself in that situation, or if you know anyone who is, please give us a call, and we'll see what we can do to help you find a program that's going to help you get your medication at low or no cost. You can reach us at 1-800-432-2080 or online at www.nmaging.state.nm.us. Okay, so this is hard for me to see. Before we move on to some of the more general resources, does anybody have a question about the ADRC or other Aging and Long-Term Service Department programs?
No.
Okay. So this is a fantastic program that I want more people to know about. It's called the Affordable Connectivity Program. For low or fixed income people, you may qualify for this program that gives you a discount on your internet service, up to a $30 a month discount. Basically, if you qualify for any Medicaid program, such as the Medicare Savings Program that we were just discussing, you're going to qualify for the Affordable Connectivity Program, and you can get up to $30 a month off on your internet service, right? This is a great way to save money. Depending on which provider you use, you may also get a one-time discount of up to $100 for a laptop, tablet, or other computer. Okay, so I can help you. Like if you call me and ask for help with a Medicare savings program, I'm also going to help you connect with this program. Another really important thing. So I've been talking about how you can apply for your Medicare savings program on Yes New Mexico. This is what the website looks like. So you create an account, you go in, and you're gonna apply. You're gonna apply for medical assistance. Let me go back there. If you're applying for an MSP, and then you're not going to apply for Medicaid once you get into that part of the application. You're going to apply for the Medicare savings program, right? A lot of times people apply for the wrong benefit. They just apply for Medicaid, and then all they get is family planning, and then they're all cranky because they're 65 or older and they don't think they need family planning anymore. So the problem often isn't that they don't qualify for the Medicare savings program, it's that they didn't know which benefit to apply for. So it's clearly labeled there, Medicare savings program. You can also apply for food stamps, energy assistance, and water assistance. Water assistance is new. That benefit just started a couple of months ago. And you can do it all in one application. The other thing that I wanted to point out on the Yes New Mexico website is that this one right here, the third button down, non-tax filers, click here to apply for an economic relief payment. You may have heard that this year the New Mexico State Legislature voted to stop taking state taxes out of your Social Security check. If you file state taxes, you're going to get a tax rebate related to that automatically. Everyone who files state taxes is going to get a $500 or $1,000 if you file jointly as a couple rebate this year. It's a one-time rebate. If you don't file state taxes, and most of the people that I work with through the Aging and Long-Term Services Department don't file state taxes because their income is under the limit and they're not required to. If you don't file, you have to go through the extra step of applying for this benefit here in order to get an economic relief payment that's equivalent to that tax rebate. Okay, it is super easy. You don't have to create an account. You just click right here, and it literally takes about 5 minutes to get this application in. It closes May 31st. So if you don't file state taxes and you want to get this economic relief payment, you need to go on Yes New Mexico as soon as possible and get this application complete. If you don't have a computer or you don't feel comfortable doing it on your own, you are welcome to call me. I've done this for a lot of people and I will get it done for you. It takes literally 5 minutes. Okay, does anybody have questions about the Affordable Connectivity Program or the economic relief payment or Yes New Mexico in general?
I didn't get or see where you were saying, you know, people over 65 click on the wrong button or the wrong link.
We can't get into that part.
Okay.
I can't go all the way through the website because you have to log in to get to that
Okay,
information.
that makes sense now because I
Yeah.
was like, what did I miss?
Yeah, but if you need help with that, I'm happy to help. You can go in and create an account. Often either people don't have computer skills to navigate this, or they've gone and looked and they're like, they get overwhelmed and they want some assistance with it. So you can call me. I'll either set up your Yes New Mexico account for you or get the information from you and go into your account, and we can do that together also. Okay, so unfortunately, COVID continues to be relevant. Medicare does cover COVID-19 testing. It also covers antibody treatment if you develop COVID When you get any COVID related service, even though it's going to be free, the provider will ask for your Medicare information because they're going to charge Medicare, right? Medicare does cover it, so they have to get your Medicare information. And then, but you shouldn't have any copay or coinsurance. The deductible also doesn't apply to these coverages. Medicare is covering telehealth during the COVID emergency. This has not ended. I have high hopes that they're going to continue it. Prior to the pandemic, telehealth was only covered in very limited circumstances. I think that it's proved to be, even though, it's not ideal for all medical health visits, for a lot of them, it works just fine. And I hope that they're going to continue this benefit even after the pandemic is officially ended. But for right now, you need to know that it is still covered. And whether you have original Medicare or a Medicare Advantage plan, it should be covered. I have worked with a number of people who said their Advantage plan wouldn't cover the telehealth, and helped them resolve those issues. The vaccine obviously is covered. I think at this point, most people have all the information that they want or need about vaccines. But just know that you can get assistance if you need help finding a booster shot or getting scheduled for something through the ADRC at 800-432-2080. I think it's also really important to know where to go. If you lose your vaccination card, you can get a new one at www.vaxviewNM.org. Okay, and the vaccine and booster, any shot should be free. And again, they'll ask for your Medicare information, but you shouldn't be charged anything. During the pandemic, Medicare is allowing 3 months of prescription refills at a time at a pharmacy. Normally, Medicare only allows 3 months of prescriptions at a time through mail order. But during the pandemic, they extended that to allow people to pick up 3 months worth of their medication at a time at their local pharmacy. I don't know how long that benefit's going to last, but that is the way it is right now. You can request that. Okay. If you, we're open for general questions now. I want to point out that on our website, www.nmaging.state.nm.us, there's a live web chat available during business hours. So sometimes it can be hard to get through to our number, where we get a lot of calls and we're understaffed at the moment. Right now, when you call the ADRC, they're making appointments, they're scheduling appointments. So you may or may not reach somebody who can answer your questions immediately. With a web chat, you can go on, you can type in your question. It's a live person. Her name is Roseanne. She works in my office. She will either be able to answer your questions or she will put in a referral and have your local SHIP coordinator, it may be me and maybe one of my colleagues, get back to you with the answer. So there's more than one way to reach us. Does anybody have any questions for me right now?
No, I'm good.
Not right now.
Okay, it's a lot, right? It's a lot of information. So I just want to remind you that you have multiple resources as you kind of absorb all of this information. You can go on to our YouTube channel and you can look at this workshop recording or the previous one, right? And then you can go through things at your own pace, stop. You can also go on to the Medicare.gov website. You can look at the information that's there for people who are new to Medicare that we toured briefly during the workshop. You know, as I mentioned at the beginning, I am a teacher by trade. I was a classroom teacher for, I don't know, 16 years maybe before I stopped and started doing this work. And so I really know that sometimes it takes looking at the same information in multiple ways in different formats for it to be fully absorbed. So really, I encourage you to do that. And then if you have further questions, you can always talk to me and I will meet you where you're at with that, right? Answer your questions and any personal questions about your individual situation we can work with over the phone. Here's how you reach me. My email is chris.winterroad@state.nm.us. I put my information out because I want to be able to answer your questions. And, you know, Eloise can attest to this because she got the information about this from the Retiree Healthcare Authority workshop where I give my information to people.
Yes, I did. Thank you.
Right. So she's living proof that I mean it when I say you're welcome to reach out to me. And my number, this is my direct work cell phone number, is 505-470-4443. Here's the information about our YouTube channel. There is, in addition to the Medicare 101 workshops, there's a little video that will walk you through how to apply for that economic relief payment on Yes, New Mexico. And there's various other things. We're putting new things in there all the time. And I also encourage you to follow us on Facebook. If you're on Facebook, follow the New Mexico Aging and Long-Term Services Department. We're putting new information up all the time, daily, sharing information from the Centers for Medicare and Medicaid, from the national program, and also events and information from our local New Mexico SHIP program. Okay, does anybody, oops, I don't actually have the survey up. I have to update it, so I'm going to leave it right here. That is the end of what I have for you today. Do you have any, I keep asking if you have any questions. I'm assuming that you don't, but if you do, now's your chance. And if not, thank you so much for spending this time with me this morning, and I'll be happy to, answer any individual questions you have offline later.
Yeah, there's just way too many questions I have, and I don't know where to start.
Yeah, Robert, I'll give you a call and we'll set up an appointment.
Okay, I appreciate that.
No problem.
And this is informative, and yet it's over informative. As of in, what did she just talk about?
It's a lot.
I want you to know that this is highly informative and, is very good resource.
Oh, good. I'm glad you think so, Robert. Thank you.
Thank you, Chris.
Thank you, Eloise.
Bye now.
Bye-bye.
So I'll get in touch with you sometime.
Yeah, I'll give you a call.
Okay, I appreciate, again, what you're doing. Okay, you guys are amazing.
Well,
thank you so
Robert.
much.
I'm glad to help.
Okay,
Okay,
bye.
bye.